we're going to start this next one lying down. So make your way down to lie on your side. Remember that anything that you do that creates intra-abdominal pressure is not great. So we want to come down via our side to lie on our back so that we don't create too much intra-abdominal pressure there. And then just take a couple of breaths to allow yourself to sink into the floor. Feel your pelvis is heavy. Feel the back of your rib cage, the back of your skull, the centre of the back of your skull. So you're trying to be nice and aligned in this position with your feet in parallel, grounded down. Let your whole body be heavy. And then as you exhale, you're just going to gently round your lower back, and you're not going to activate anything. You're just going to think of moving the bones of your pelvis, tucking your pelvis under as you exhale, and then inhale to rock back into a neutral spine, feeling the gentle curve in your lower back. Breathing out, round your spine, let your pubic bone draw towards your rib cage, and then breathe in to let go, and try not to think about your muscles. So let your bum be relaxed, let your belly be relaxed. Just mobilise your pelvis, feel your lower back opening as you rock backwards and forwards. Breathing out, and then breathing in to let go. And 2 more. And last one. This time you're going to round your lower back and then take your pelvis round to your right, through the middle again with this very small arch through your spine, and then over to the left to tuck under again. So it's like you're drawing a little circle or going around a clock face with your pelvis. And if you think, like, if you're at 12 o'clock with your pelvis when you're in the centre, notice as you go round where the tight spots are. So you might find at kind of 4 o'clock, 5 o'clock, it feels a little bit more stuck, and just notice those bits. And again, don't worry about working anything, but just find some mobility in your pelvis here. And then let's circle in the opposite direction. Keep breathing. Think about what's happening in your upper body. Are your shoulders nice and soft? Is your jaw relaxed? Allow your body to be heavy, finding that mobility through the hip joints, through the lower back, just opening up any tightness that you might be holding there. And don't worry about sort of doing too much. You know, you may not feel lows as you're doing this, you might not really feel a stretch, but I promise you this is going to really help your pelvis and your pelvic floor to recover and release. And now take your feet a little bit wider, and then gently allow both knees to drop over to your right. Take a deep breath in there. Think of opening up the whole of the left side of your body with that inhale. And then exhale and think of yourself softening further into the floor. Allow your body to be heavy. And breathe out to sink further. And then on our next exhale, again, we're not going to try and do too much. We're just going to gently bring the legs back to the centre, and then let the bones fall over in the opposite direction. And notice any differences between the sides. So you may find that one side feels a little bit tighter than the other, or you may find that you feel the stretch in slightly different places each time. And that's absolutely fine, but it is really worth, use this program to get to know your body. It's not just about getting more flexible or getting stronger. It's about feeling what's going on in your body and noticing how you're using your body day to day. Now on your next exhale, gently pull the legs back into the centre. bring your feet a little bit closer together and then hug your right leg in towards your chest. That might feel like enough for now, or if your lower back is really comfortable, you could try extending the opposite leg, but do be mindful, if it doesn't feel great in your lower back, then having the underneath leg bent is going to be a better idea. And then just lie there, allowing your thigh bone to be really heavy. Let yourself, the thigh bone, sink into that hip socket. And then slowly start to circle the thigh bone within your hip joint. So don't, again, go for loads of sensation necessarily. It can be really nice and gentle, just feeling the weight of your thigh bone, feeling your thigh bone sinking into your hip joint, and then circle the other way. Nice deep breaths, feeling the sense of heaviness throughout your entire body. And then allow that leg to relax down to the floor, and just take a moment to feel any difference between the sides. You might find that that side that you've just worked on feels a bit longer and like there's a bit more space there. And then hug your other leg in and gently circle the thigh bone there. Breathing deeply, feeling the weight throughout your entire body. And then circle the leg the other way. And then bring both legs in to bend and make yourself round to lie on your side. So you're going to, you can grab a cushion actually if you want to pop your head onto something. If it doesn't feel completely comfortable lying here, just pop your head onto a cushion underneath you. And then you're going to reach your top arm forwards along the floor, and as you do that, send your top hip in the opposite direction. So you're sliding your top knee back behind you, and then slide that leg forwards, bend your elbow and come into a nice twist. Or you might have heard my back do a little crack there. So don't force it, but just gently rocking your upper body in one direction. So your arm is coming forward, your hip is coming back, and your lower body in the opposite direction. So now your upper body is coming back and your hip is coming forwards. And then just keep moving like that, really feeling that mobility. Keep going. I'm just going to show you from sitting, just in case you couldn't entirely see there. So you're going to reach your top arm forwards and send your hip back in the opposite direction. And then your hip is going to come forwards and your elbow is going to come back. So your arm comes forward and your hip moves backwards. And then your hip comes forwards and your elbow moves back. So stay where you are while I just bring myself back down to meet you. And now this time you're going to reach the top arm forwards again, but then you're going to circle that arm up past your ear. Feel that lovely stretch through maybe your armpit, maybe your lats, and then let your rib cage gently rotate as you come around and back to start again. So again, I'm just going to show you that from a seated position, just in case you couldn't quite see the angle. So you're going to reach that top arm forwards, circle your arm up past your ear, and now bring your rib cage with you as you come into a lovely rotation. And then going again, reaching forwards, circling up, and all the way round. And one more time. And then make your way round onto the other side. And then go again. So you're going to reach your top arm forwards and send your hip back behind you. And then reach your hip forwards and gently pull your elbow back. So your upper body and your lower body are moving in opposite directions. And at this point, particularly if you're within the first 6 weeks of having your baby, but especially if you're in the first 6 weeks of having your baby, or even if you're further along, you don't really need to be worrying and sort of stressing out about abdominal separation just yet. But this is a good one to help reduce sort of over separation in the abdominals, because we're really mobilising all of the muscles that might be holding your abdominals away from each other. So if you've got any concerns about abdominal separation, this is a great one to get started with. And then this time, reach your top arm forwards, circle it up past your ear, come all the way round and back to start again. So again, I'm just going to show you from up here. Reach your arm forwards, circling up and back again. And again, just notice as I'm doing it that I'm really trying to get my ribs to move. So don't do it from, like, don't allow your shoulders to kind of hang out of your hip, of your shoulder socket. If it kind of clunks or makes any weird noises, then try and reduce the movement in your shoulder and increase the movement through your rib cage. Okay, you're done. I hope that feels good.